Are you struggling with breathlessness, digestive issues, fatigue, or unstable blood sugar? In my last video, I explored how COPD, diabetes, and IBS aren't separate problems. They are connected through inflammation, gut health, nervous system stress. Today, I want to reveal in this video the missing link that ties them all together, the vagus nerve. It's not just another nerve, it's your body's communication highway for breath, digestion, immunity, and metabolism. But in this video, you'll know how conscious breathing can directly influence your vagal tone, improve your lung gut brain communication, and support your overall health. Hey there, if you're new here, I'm Dr. Devi Sundar, Integrative Mind Body Consultant. Here's what I'm going to cover today: what the vagus nerve does, how vagal dysfunction contributes to COPD, diabetes, and IBS, the scientific evidence connecting breath, inflammation, and metabolism, one simple daily practice to begin restoring regulation and safety. All claims I discussed in this video are backed by research. I will reference those studies so you can read them yourself. Research shows these triad conditions, COPD, IBS, and diabetes, often co-occur and they share a mechanistic pathway. Let me confirm that with the research evidence. COPD and diabetes. COPD increases the risk of type 2 diabetes, worsens inflammation, and alters metabolism. Research evidence from Angle et al. 2025 confirms this. Now, IBS and COPD. IBS patients show a higher long-term risk of developing COPD, likely due to systemic inflammation and autonomic nervous system dysregulation. And a paper from Lear et al. 2020 confirms this evidence. Metabolic syndrome and airway dysfunction. Chronic low-grade inflammation links the gut, lung, and metabolic disorder. And a paper from Zia et al. 2025 confirms that these conditions are not just organ problems, they are regulation problems. As I mentioned in my intro, the missing link to these three triad conditions is the vagus nerve regulation. The vagus nerve is a cranial nerve connecting your brain, lung, gut, heart, and immune system. 80% of the fibers carry signals from the body to the brain, regulating how your body communicates stress and inflammation, controls the bronchial tone, gut mobility, and immune responses, modulates blood sugar, metabolism, and emotional regulation. A paper from Undem and Kolarki 2005 reveals that vagal dysregulation contributes to bronchoconstriction, mucus secretion, and cough in chronic obstructive pulmonary disease population. And another paper by Sorsky and Gridon 2023 confirms that low vagal tone predicts type 2 diabetes. Higher vagal activity correlates with reduced inflammation. Another paper by Bonas et al. 2021 shows that reduced vagal tone is linked with gut dysmotility and inflammation. Vagus nerve stimulation improves the irritable bowel syndrome IBS symptom. So what we can learn from these papers are when the vagus nerve is underactive, your body stays in a survival mode, increasing that inflammation and organ stress. As I mentioned in my last video on gut-lung axis, your gut and lung communicate through vagus nerve. Gut-derived inflammatory metabolites influence the lung inflammation and metabolic stress. This is confirmed by the paper from Bang et al. 2023. So, supporting vagal tone can improve the lung, gut, and metabolic regulation simultaneously. So here's my question. What is the fastest non-pharmacological way to influence your vagus nerve? So the answer is conscious breathing. So research shows slow nasal breathing increases the parasympathetic activity. Extended exhalation lowers the inflammatory cytokines like TNF alpha. And diaphragmatic breathing improves gut motility and insulin sensitivity. So breath is not just oxygen, it is the information your nervous system receives. So what does Ayurveda teaches us? Pranavayu, breath and movement, and Samanavayu, digestion and assimilation. When these two forces are balanced, digestion, metabolism, and nervous system regulation work optimally, exactly as modern research describes vagal regulation of multiple organ systems. Now, I'm going to share one simple daily practice to start improving your vagal tone. Sit comfortably, spine straight. Inhale through your nose for 4 seconds. And exhale slowly for 6 seconds. To send feedbacks to your nervous system and information signals to your nervous system, place your hand on your belly and feel your belly raise and fall. Repeat for 5 minutes, ideally before meals or sleep. So what are the benefits you're going to get by doing this practice daily? You're going to improve your vagal tone, reduce your IBS symptoms and gut inflammation, and support your COPD lung function, and lower your systemic inflammation and metabolic stress. Remember, consistency matters more than the intensity. So if you're struggling with this triad condition, COPD, IBS, and diabetes, remember again, your body is not broken. It's simply asking for integration, rhythm, and safety. Every breath, every digestive signal, and every moment of stress is your body sending the message it wants regulation, not force. At Therapies, I offer programs designed to meet your body where it is and guide it back to balance. My 14-day Breathe to Try program is a gentle, structured program to reset your breath, calm the nervous system, and support your gut-lung-brain communication. Even just a few minutes a day can help restore rhythm and reduce chronic stress signals. In this 14 days, you're going to learn how to maintain consistency in your breathing practice and how to regulate your vagal tone. Our next program, Breathe to Think, is under 40 and more suited for the students, professionals, and those who are the beginners with the triad condition to learn how your breath, digestion, anxiety are intertwined and gain practical tools to improve focus, emotional regulation, and metabolic balance. And I'm also delivering training to the professionals, my respiratory psychology training, aimed at healthcare professionals, therapists, and coaches who want to apply the nervous system-based strategies clinically, empowering their patients to optimize their breathing, gut health, and metabolic regulation. Remember, healing begins with safety, not force. Your body heals best when it feels safe, when the nervous system can downregulate, and when inflammation is no longer dominating its signals. Every conscious breath you take activates the vagus nerve, improving that communication between your brain, lung, and gut and immune system. Stay curious and stay kind to your body. And together, let's breathe, restore, and thrive. Signing off, Devi.